Blepharitis is also known as bugs in your eyelashes, and it doesn't sound so great, but I got a way for you to get rid of it for good. Hey, good optometry. I'm Dr. Michael Nelson, your YouTube eye doctor, and today I'm going to share with you what is blepharitis, what causes it, why it's bad for you, and the 3 ways that you can get rid of this for good. So technically speaking, blepharitis is an inflammation of the eyelids and the eyelashes, but I will often explain it to my patients as a chronic mild lid infection because we have normal bacteria that live on our skin. It's called the flora, and there's organisms, there's bugs and bacteria that live on our skin, and it's supposed to be there and it needs to be there. And you also have bugs and bacteria that live around your eyes and your eyelashes, and again, it's supposed to be there and need to be there. But in some individuals, there happens to be a little bit more than you need. And no fault of your own, not because you're dirty, but just because the environment is perfect. Could be maybe the pH is perfect, maybe the temperature is perfect, maybe they just like how you smell, I don't know. But for whatever reason, in some individuals, the bacteria that's living on your eyelashes and eyelids, it just goes crazy. So almost 50% of people have blepharitis. So that means if you're watching this video with someone else and they don't have blepharitis, that means you have blepharitis. And there's lots of different types of organisms that can contribute to blepharitis, but the most common one is bacteria. And there's a specific type of bacteria that loves to live on our eyelashes. It's called Staphylococcus aureus, and it's supposed to be there and it needs to be there. And when it goes a little bit crazy, you have more of them than you need, and they're also producing a lot more waste products than would actually be there. And those waste products are called exotoxins because they irritate the skin, and if they fall into your tears, they irritate the surface of your eye. Some people are very, very sensitive, hypersensitive to these exotoxins, and they get a significantly more amount of irritation and inflammation than other people, and those are the people that have blepharitis. And so although blepharitis really isn't going to cause any vision loss or permanent vision impairment, it's going to cause a whole ton of symptoms that are super, super annoying. So it can make your eyes burning. It might make them itchy, might make them stinging. It might cause your eyes to be red, not only your lids, but also the surface of your eyeball to be a little bit more red. It could cause crusting and sticking of your eyelids. It can cause a gritty, burning, almost foreign body, like something's in your eye all the time. It can cause you to have little flakes that looks like little bits of dandruff in and amongst your lashes. It can cause you to be more sensitive to light, and it can cause you to blink more, and it can start to affect your lashes. It can cause your lashes to grow in funny directions, and it can cause your lashes to fall out, and it can cause you to have more frequent infections of your eyelids and the surface of your eye. But not only that, it can also cause dry eye disease because it can start to affect the glands in our lid called the meibomian glands and cause meibomian gland dysfunction, which is the most common form of dry eye disease. So eye doctors love to talk about details of blepharitis, and they'll often say there's anterior blepharitis and posterior blepharitis, but these are just academic terms, meaning the anterior affects the eyelashes and the posterior affects the glands, the meibomian glands at the back of the lid. But really, if you have one, you probably have both, and we're going to treat them both, and we're going to treat them the same way. Now, on a side note, blepharitis is also associated with conditions like rosacea and eczema, which also affect glands and the surface of our skin. So there are basically 3 ways that we're going to use to get rid of your blepharitis for good. Now, make sure you stay to the end of this video because I'm going to share with you some tips that you definitely don't want to do to treat your blepharitis. So first of all, we're going to talk about at-home methods that you can use to treat your blepharitis. So the first one is heating up your eyelids. So if we can heat up your lids, and more specifically, if we can heat up the glands, the meibomian glands in the back of your lid to around 41 degrees Celsius or 105 degrees Fahrenheit and keep it there for about 5 to 10 minutes, that can soften the oils in that gland, get them to start flowing better, and express out all the waste products and the inflammatory products that are building up in those glands, causing some of the blepharitis and the dry eye symptoms that you're having. So in order to do this, you can do some warming masks. So there's a few different types that you can get. All of these, you're going to heat them up in the microwave for a period of time. It's going to get nice and warm, and it's going to hold that heat for about 5 to 10 minutes. You can also get some of these gel packs that when you click them, they can get warmer and then you can reset them. And there's also some electronic versions that you can plug into a USB port to get to warm the lid as well. And I'm going to put some affiliate links in the description down below, so if you want to pick any of these up to try, you can do so. Now the next at-home thing that you need to be doing is cleaning around your eyelids. So we need to do some type of lid wipe to clean around our eyes. So All of us wash our body with soap. You wash your hair, you wash your body, but almost nobody washes their eyelids with soap because it stings and burns. And just splashing water or running water or spraying water on your eyes isn't going to get off the exotoxins or the bacteria. So you need some type of surfactant or solution to help clean off the exotoxins and the bacteria. All these lid wipes are available for you to use to clean and around your eyelids, and you use them once or twice a day on an ongoing basis to get rid of the exotoxins and the bacteria. Now, these are also available in a pump foam type of thing, so if you don't want to use the cloth, so if you don't want to use a towelette, you can just put it on your finger and then just scrub around your eyelashes and do that as well. And another at-home treatment that you can do is something called hypochlorous acid. And this is a spray. You just close your eyes and you just spray one spray on the surface of your eyelids, and if it falls into your eyes or your tears, it doesn't sting or irritate it. Sounds a little bit scary because it has the word acid in it, but this is safe to use in and around your eyes. What this will do is it will bring down the bacteria count in and around your eyelashes. Now, it's not going to get rid of the exotoxins, but it can help diminish the number of bacteria that you have on the surface of your eyelids, and you can do this once a day. So the second thing that we can do to treat your blepharitis for good is using some type of prescription product. So the first one that we might start to use when blepharitis really gets out of hand, it will be some type of antibiotic. Now, I typically will use an ointment for this because I want some on your eyelashes, and what you're going to typically do is clean your eyelids with some of the lid wipes first, and then you just put a little bit of antibiotic ointment on your finger, and you don't need very much. You don't need to cake it on. You just need a very, very minute amount of film, just wiping that on your lashes, and that will help bring down that bacteria count. Now, we will also sometimes use an antibiotic steroid medication because the antibiotic will get rid of the bacteria, and then the steroid will bring down the inflammation that's developing in and around the lid. Now, we need to be careful using steroids because long-term use of steroids in and around your eyes can increase the risk for glaucoma and cataracts, and we definitely want to avoid that. So we're typically only doing this quiet down a really large flare-up of blepharitis. Now, there are also some oral antibiotics, and so oral antibiotics can sometimes be used to quiet down the inflammation as well as get rid of some of the bacteria count in and around the lashes. So these are all prescription products that we'll use in more serious cases of blepharitis. And the third option that you're going to use to get rid of your blepharitis for good is some type of in-office treatment that you're going to do at a doctor's office. And the three I'll mention here is there's one called BLEPHACLEAN, and basically this is an instrument with a little brush that brushes and almost like a toothbrush that cleans around your lashes, and the ocular hygienist is going to use this in conjunction with some type of foam-like solution to clean and manually debride all the debris and help really get off some of that stubborn blepharitis that's building up. You can also have a treatment called radiofrequency or RF, which is a heat treatment to the lids to really get those glands flowing really, really well. And then there's another treatment called IPL or intense pulse light, which is really effective in reducing the bacteria count in and around the lashes. Now, I've got other videos on RF and IPL up here, and if you want to watch those. Now, a couple of things that you definitely don't want to do when you're treating your blepharitis. Number one, I mentioned about hot compresses and heating your lids. What you don't want to do is just use a washcloth because basically it cools off too quickly. You can heat it up under hot water, but then within about 10-20 seconds, it's cold again. So you need something that holds the heat for a significant amount of time. The second thing you want to do when you're cleaning around the eyes, we used to recommend using baby shampoo because it doesn't sting your eyes so much. And some people are still recommending that, but they've done studies looking at baby shampoo, and the preservatives and the soaps in baby shampoo, which technically don't sting your eyes as much, they can cause an inflammatory effect, and they've shown that they might not be as helpful as we thought. And you're better off using some of the specific eyelid wipes that are formulated for treating blepharitis and to be used around your eyes. And the last recommendation is there are over-the-counter antibiotics that you can pick up, but oftentimes they are not as effective as the prescription antibiotics that your doctors prescribe. So I would avoid using any of the over-the-counter antibiotics to try to treat your blepharitis. Definitely see your eye doctor to try to treat them with those if you need them. Now, if you tried any or all of these options and it's not getting rid of your blepharitis, there's a possibility the culprit could be something called a DEMODEX mite. And it should be your very best friend, but it could also be your worst nightmare. Hey, so in this video, I'm going to explain to you the good, the bad, and the ugly of those pesky DEMODEX eyelash mites so you can know what to do in case you need to get rid of it. So DEMODEX is a mite that lives on the skin of mammals. It means that it survives by eating dead skin, bacteria, and oils that are on our skin. Now, DEMODEX is a normal part of our microbiome, and it's supposed to be there, and it does a great job for us in getting rid of some of those excess oils and cells and bacteria that's not supposed to be there, as long as it doesn't get out of hand. And if the numbers of DEMODEX stay low, they're perfectly harmless and don't cause any symptoms at all. So I want you to think of DEMODEX as having kind of teenagers in your house. So if you have a couple of your own teenagers in your house, they're great. They're good to have around. They're fun. You love them and you like them being part of your family. And there's not a problem. But if the environment is just right, let's say there's the right type and right amount of food, there's good beverages, there's a good environment, like maybe some music, maybe the environment, the parents are away, maybe it's late at night. Some other teenagers might find out that your environment in your house is really great for teenagers, and they start showing up in more numbers than you need. And if you have more teenagers in your house than you're supposed to have because the environment's so good, they can throw a party and things can get out of hand really bad and cause lots and lots of problems. And that's just what it's like with DEMODEX. If the environment's right on our lids and our lashes, you can get more of them than you need and they cause a lot of problems. Now, there are about 65 different types of DEMODEX mites that live in our world, but there are only 2 that live on our lids and lashes. And in fact, there's actually only 2 that live on humans. And these 2 I'm referring to as the DEMODEX duo. And basically, one of them is called DEMODEX follicularum, and the other one's called DEMODEX brevis. And DEMODEX follicularum, they live around hair follicles, which include the eyelashes. And DEMODEX brevis, they love to live in sebaceous glands like the meibomian glands in our upper and lower eyelids. Now, like I said, there's lots of different types of DEMODEX mites, and pets will carry them as well. And in fact, you may have heard of a condition called mange in dogs, and that's actually caused by a particular DEMODEX mite that only lives on dogs. But don't worry, those DEMODEX mites can't transfer to humans, and likewise, the DEMODEX duo that lives on humans can't transfer to your pets. So this DEMODEX duo that lives on our body can live anywhere on our skin. And so that's why these will be referred to as either eyelash mites, maybe skin mites, or maybe even face mites. But I'm going to be specifically talking about how they affect our eyelashes and our eyelids. All right, so what do these DEMODEX mites look like? Well, they are super, super tiny. They are about 0.2 to 0.4 millimeters in length. And they are a cigar-shaped organism with 4 legs, and they have a transparent body. And so they're almost impossible to see unless you have a high-powered microscope that you can look at them. And even the microscopes that we use in the clinic to look at the surface of your eyes, most of them don't have nearly enough magnification for us to detect or see a specific DEMODEX mite. So I'm going to talk about who has DEMODEX mites in a moment, but let's talk a little bit about their life cycle. So DEMODEX don't live very long. They only live about 2 to 3 weeks, and it takes about 3 to 4 days for them to hatch from their eggs, and then about 1 week to become the adult form, and then for the next week or 2, they basically spend that time eating and mating, laying out their eggs, and then they die. So interesting things about DEMODEX, they move extremely slowly. Basically, they move the rate of 16 millimeters per hour. So very, very slow moving. They mostly live in and around the follicle, but they go in and out of the follicles as well as the oil glands of our lids, and they are most active at night. Now, one interesting thing about DEMODEX is they don't poop, but they do molt and shed some of their skin, and they can also excrete some enzymes which help them digest some of the food that they're trying to eat. And these are going to cause all sorts of symptoms, but before we get into that, let's talk about who might actually have DEMODEX. What we know is that newborns and babies often don't have DEMODEX on the surface of their skin, but we get more of them as we get older and older. Another interesting thing is some studies have shown that there are some certain populations, particularly those that are very remote and not in urbanized settings, that don't have any DEMODEX on their skin. Studies have shown that about 2 to 27% of those in our 20s and 30s will have some amount of DEMODEX on our eyelashes and eyelids, and 80% of individuals over 60 will have DEMODEX on their eyelids and eyelashes, and 100% of those of you over 70 years old will have DEMODEX in and around their eyelashes and lids. So if I go back to our teenager analogy, if DEMODEX get a little bit out of control, they love to throw a party. And when that happens, we call it DEMODEX Blepharitis, or DB. And like I said, those are going to cause all sorts of symptoms we're going to get into right away. But about 50 to 60% of the North American population will have some amount of DEMODEX blepharitis. Now we know that DEMODEX is going to love certain environments and certain types of people. So they love to live on people that have oily skin, and they're more prevalent in people who have diabetes. And we know that people that have cataract surgery will often have an increased amount of DEMODEX. We know that stress can increase the amount of DEMODEX. We know that people that are immunosuppressed or who are on immunosuppressants will more likely have DEMODEX blepharitis. And we know that increased alcohol take and smoking will both increase the amount of DEMODEX that you have on your eyelid. We know that DEMODEX blepharitis is more associated with those with rosacea, meibomian gland dysfunction, dry eye disease, and styes. And when DEMODEX mites start to have a party, they can get really out of hand, and you can get up to 25 DEMODEX mites in each gland or hair follicle. So when you have the normal amount of DEMODEX mites in and around your eyelashes and eyelids, you're not going to have any signs or symptoms, and you won't have any problem at all. But if you develop DEMODEX blepharitis, you're going to have lots of symptoms. So you're going to often get itchy, irritated red lids, and the surface of your eye can also become red and irritated. And this is often from the molting of the DEMODEX mites. They're from some of the enzymes that they release to digest their food. They're from the waste products of dead DEMODEX mites that die on the surface of your skin. And they're also a lot of waste products that are produced when the DEMODEX are eating skin cells, bacteria, and the oils. And these will accumulate in and around your lids and lashes, and they can also fall into the surface of your eye, on your tears, and cause inflammation in and around your eyes. Now, one sign that we can absolutely see, and this is the way that we diagnose DEMODEX blepharitis, is that we'll see these little collarettes or flakes of debris that are right at the base of the eyelash, and those are a hallmark sign of having DEMODEX blepharitis. Now, some people will claim that they can feel DEMODEX moving around on their eyelids and eyelashes, but like I said, they move so slowly and they're so microscopic that you're not going to feel these moving on your eyelids. So if you think you're feeling that, it's just psychological. You're not feeling those bugs moving. But we know that these bugs can damage and irritate the lashes of our lid. They can cause your eyelashes to grow in different directions. They can even cause your eyelashes to fall out. And DEMODEX can clog and block and inflame your meibomian glands, which can lead to meibomian gland dysfunction. And I've got a whole video on that up here, which can lead to dry eye disease. And that dry eye disease caused by DEMODEX blepharitis will cause you a foreign body sensation. It can cause your eyes to be more watery. It can cause you to have blurred vision, and it can cause your eyes to be very sensitive to light. And DEMODEX blepharitis can also cause you to get more frequent eye infections, including styes in the eyelid. So I'm going to tell you some of the things that do not treat DEMODEX in a few moments. First, let's dispel some of the myths that are out there about DEMODEX mites. So number one, DEMODEX mites are not contagious. So that means if you share a bed or a pillow or towels or touch surfaces that someone with DEMODEX blepharitis has, you're not going to contaminate yourself and give yourself DEMODEX blepharitis. Again, if we go back to our teenager analogy, if your neighbors have a crazy party of DEMODEX teenagers because they have the perfect environment of food and beverages and entertainment and whatnot, but you don't have that same environment in your home, those DEMODEX teenagers, they're not coming over to your house to infest your home unless you have the same environment as over there. Now, in theory, you can transfer DEMODEX mites from one person to the other directly. But that's only going to happen if you're taking your hand and rubbing someone's eyelid and then take that same hand and rub your eyelid. You're probably going to transfer some DEMODEX mites to your eye. But if you don't have that perfect environment for them to thrive in, those DEMODEX mites that are transferred, they're not going to thrive and be overrun, and they'll probably die relatively quickly. Now, if we talk about where DEMODEX can live, they can live in makeup. So if you have a DEMODEX blepharitis and you're using makeup, then that DEMODEX can be transferred into your makeup. So it's probably a good idea not to try to share your makeup with other people. And like I said, DEMODEX mites can't be transferred to or from pets because they're different organisms that don't live on both species. So DEMODEX blepharitis can be a tricky thing to treat, and there's a lot of stuff that really doesn't work. So we know that 75% alcohol, which is often what you use in alcohol swabs, those will not get rid of DEMODEX mites, and you're not going to be wanting putting those in and around your lids because that's going to burn like crazy. Likewise, we know that 10% povidone iodine, which is commonly used to disinfect the surface around your eyelids, particularly before surgery, we know that that will not kill DEMODEX mites. Likewise, any cleaning or disinfecting wipes are not going to have any effect on treating DEMODEX. As well, oil products like olive oil, vegetable oil, anything like that is not going to have any effect on getting rid of DEMODEX mites. And we know, because DEMODEX mites are not bacteria, that antibiotics like erythromycin will not kill DEMODEX mites. Sometimes when people think of mites, the image that comes to their head are actually going to be ticks, fleas, or maybe even lice. And because mites are different than all of those other organisms, they're not going to respond to the same type of treatment. So treatments for fleas, ticks, and lice are not effective treatments to treat DEMODEX mites. So that includes smothering your eyelids with Vaseline. That's not going to really have much effect on DEMODEX mite. Likewise, shaving your eyelashes or shaving your eyebrows are going to have no effect on getting rid of DEMODEX mites, but that definitely will make you look really goofy. We know that shampoo and washing in and around your eyelids isn't going to get rid of DEMODEX blepharitis. Now, I've got a whole nother video about bacterial blepharitis, which a lot of people will have as well. I'm going to put that down in the description below. And all of the treatments that you might use to treat bacterial blepharitis are going to have no or little effect on DEMODEX blepharitis. And for that reason, a lot of times some patients, they're diligently treating their bacterial blepharitis with all the things that their doctor has given or recommended, and they're finding that, hey, my blepharitis is not getting better. And that also could be a hint that this might actually be DEMODEX that's causing the problem and not bacteria. So washing and scrubbing around on your eyelids are some of the in-office treatments like BLEPHACLEAN, where they're scrubbing around off on the lids. Those things are going to be good at getting some of the waste products that are causing some of the irritation. So they're going to help with some of your symptoms, but they're not going to have any effect of actually getting rid of the DEMODEX mites themselves. So they'll help a little bit with the symptoms, but won't solve the problem completely. And likewise, anything that kills bacteria, which will include antibiotics, but it can also include something called hypochlorous acid spray, which is something that we use to get rid of bacterial blepharitis. Those will kill the bacteria that are living around our lids and our lashes, which some people say, well, that's going to help DEMODEX blepharitis because the DEMODEX eats bacteria and it's going to take away some of their food source. However, DEMODEX have a lot of different food sources, which include bacteria, but it also includes the oils and the skin cells. So DEMODEX have lots of other food sources if you get rid of the bacteria. So those treatments that are dealing with the bacteria, not going to get rid of DEMODEX mites. But there are some things that are very effective in treating DEMODEX blepharitis, and ways to treat mild, moderate, and really severe DEMODEX blepharitis so you can get rid of it. So blepharitis is super common and about 50% of North Americans have it. But what most people don't know is that there's two different types. There's bacterial blepharitis and there's DEMODEX blepharitis. And bacterial blepharitis is pretty easy to get rid of and pretty easy to deal with. But blepharitis due to DEMODEX eyelash mites, not so easy. But I've got a whole nother video explaining about what DEMODEX is right up here, so you can watch that. But let's hop right into how we treat mild forms of DEMODEX blepharitis. So there are three main types of products that can be used that are all over the counter that you can use to treat mild DEMODEX blepharitis. And if you're over 70 years old, you have a 100% chance of having DEMODEX. So I would recommend you consider doing one of these just as normal hygiene, but this is also good for those of you with mild DEMODEX blepharitis. So the first option is some form of tea tree oil. Now you've probably heard of tea tree oil, product that's used for facial cleaning, but you have to be very, very careful when you're using it around your eyes because there are a lot of different concentrations for tea tree oil. Tea tree oil will come in concentrations ranging from 2% up to 50% tea tree oil. And if you put too high of concentration on your eyelids, it's going to burn your eyes and it's going to sting like crazy. So basically any amount over 5%, I wouldn't recommend using on your eyes unless a professional is doing the treatment. Now, some people will say you can dilute it down, but why would you do that when there's a whole bunch of inexpensive over-the-counter products that are already pre-made in lower concentrations than 5%. Now here's a bunch of different eyelid wipes that are all available, and I'm going to put an affiliate link down in the description so you can pick up any of these that you might want to. But all of these are going to work really well. Now if you want to know how to use this, basically they're going to come as little wipes. Basically you're going to open up the little wipe, take out the little cloth, unfold it a little bit, and then wrap it around your fingers. And what you're going to do is clean and around your lashes and your lid. And so you're going to scrub around your lashes and your lids. You can do the area around the eye. You can do up on your eyebrow and lashes there. And then you're going to flip it over and use the other side and do the other eye, lid, and eyelashes. And that's an effective way to treat your DEMODEX mites. And so a lot of these formulas are leave-on formulas, so you don't have to rinse it off. Some of them are a little bit more foamy than others, but some of them you just leave them on and you're good to go. So a lot of these products will come as wipes as I showed you, but some of them also come in a pump foam where you pump out a little bit of foam and then you take that with your finger and you clean around your eyelids and eyelashes as well. Both of them work great, just a preference of what you prefer to use. Some people comment that the wipes maybe feel a little bit more harsh or a little bit more scrubby, and the foam is a little bit more gentle if you have really sensitive lids and eyes. So the second type of mild DEMODEX cleaner is an okra based product. So okra is a vegetable and they take the extract from that vegetable and they use that to make lid wipes, and that is also an effective way to treat DEMODEX. Now some people will say that the okra forms are a little bit less harsh than some of the tea tree oil, so they get a little bit less stinging. I don't find that the tea tree oil gives any stinging to my eyes, but some people that have really, really sensitive eyes might find that. Some people comment that the okra-based products are a little milder. And the third product that I'm going to talk about is something called Manuka Honey with aloe vera and coconut oil. Now, this product is not a honey. It's again made from the extract of the leaves of the Manuka Honey plant. And again, they have this cleanser that you can use to clean around your eyes. A lot of people will say that this is also a very gentle form of treating your DEMODEX mites. So all three of these, tea tree oil, the okra based, and the Manuka Honey formulations have a similar effectiveness in bringing down the count of DEMODEX mites, as well as getting rid of the waste products and the scruff and the dandruff and things that collect around your lashes to help treat it. So now for all of these, you're going to want to treat and clean your eyelids once per day. And usually once per day should be good enough, but you need to do this for 2 months. That's 60 days. And the reason why you need to do that is because the life cycle of a DEMODEX mite is up to 3 weeks. And so you need to do this on a consistent basis to get multiple generations of DEMODEX mites that you're killing and getting rid of in order to get this DEMODEX blepharitis really under control. So like I said, all of these products have a similar effectiveness. So if you find one burns, then go ahead and try a different one, and you might find that you prefer that one. Now, when we're talking about over-the-counter products, inevitably people are going to suggest all sorts of crazy stuff that they're going to say, oh, this treats DEMODEX for you, and they're going to say everything's all natural. But these products that I just mentioned, they're all natural based, even though they're packaged in a nice packaging and you don't get them in a supermarket shelf. And in that video I mentioned earlier, I talk about all the treatments that definitely don't work to treat your DEMODEX mites. But what I'm going to mention specifically is castor oil, because castor oil, a lot of people say, oh, this is supernatural and it cures everything. And they say, well, this is effective against DEMODEX mites. And there was a very small study of about 26 people where they used castor oil to treat DEMODEX mites, and it did have some effectiveness to treat it. Now, I don't recommend that because these other products are just as inexpensive and just as easier to use, and they're much more effective. So I would say skip the castor oil, go straight to the tea tree oil, the Manuka Honey, or the Okra Based cleaners. All right, so next I'm going to tell you about the treatment that you want to use if you have a moderate form of DEMODEX blepharitis. But before we do that, I want to just say, hey, thanks so much for getting this far in the video and watching this. And I'd like to ask you a little favor. If vision is important to you and you like hearing topics like this where I make eye care simple, then please do me a favor, hit the subscribe button and the like button down below, because that really tells YouTube that this video is valuable and they should send it out to other people. So if you have moderate DEMODEX blepharitis that's not responding to some of those over-the-counter treatments, you're going to probably have to visit your eye doctor to get some other treatments. So that eye doctors can do some in-office treatments where they're going to use higher concentrations, usually of tea tree oil, and the ocular hygienist can use it safely so it doesn't end up burning or stinging your eyes. So they can do some more concentrated in-office cleaning of your lashes and your lids. So that can be effective. But the other thing that can be used are prescription product. So one product is called ivermectin, and ivermectin is a product that's used to treat skin DEMODEX. And one form that it can be prescribed in is an oral pill where you take 2 pills 1 week apart, and that can be effective in treating skin DEMODEX. Now, this treatment is not indicated for eyelid DEMODEX, but it should have some effectiveness in treating it. Now, the oral form can be a little bit expensive, but there's also a topical form in an ointment that you can use to apply it. But again, the topical ointment is a 1% ointment that you apply to your skin. And again, the indication is using it on your skin, on your face, and is not indicated to be used around your eyes. But it could be used off-label by your eye doctor if they think that might be a good option that you could use. Now again, just like the wipes, you need to do this once a day for 2 months to get a bunch of life cycles of the DEMODEX under control. There are some people that have reported they get a little bit of skin irritation from the topical ointment of ivermectin. And if you're using the oral form, you have to make sure you have the right concentration based on your weight for you specifically. Now, another lesser used prescription product would be something called metronidazole. And this is a formulation that can be used just like ivermectin, and there's an oral form as well as an ointment form that can be used off-label like ivermectin. But if you have a severe outbreak of DEMODEX blepharitis that's just not able to handle in any other way, we have an option that's FDA approved specifically for DEMODEX blepharitis, and it's called XDEMVY, and this is an eye drop that you use twice a day for 6 weeks. And so basically you put 1 drop in each eye, and the studies, when they did it, they just put an eye drop in, but a lot of eye doctors are recommending that you put the eye drop in, and then what you do is you kind of rub the excess in around your lashes, because there's a little bit excess of that eye drop in and around, and that might be a little bit more effective of a treatment. But again, you do this for 6 weeks, and this can be very, very effective in getting really severe forms of DEMODEX blepharitis really under control. And then once you get it under control, you might be able to maintain it with some of the at-home options that I mentioned under the mild form of treatment for DEMODEX blepharitis. And if XDEMVY isn't enough to treat it, then you may want to consider adding something called IPL, or intense pulse light. So intense pulse light is a treatment that's been used in dermatology and aesthetics for a long time, and it's used to treat rosacea and sunspots. But we also now use it in the eye care field to treat dry eye disease. But one of the things they found is when you use IPL in and around your eyelashes, it will kill DEMODEX mites. So it can be a very effective treatment to kill DEMODEX mites, but also treat your dry eye disease. So treating your DEMODEX blepharitis can be a great thing for anyone because it can get rid of your symptoms, but it also can be very useful for people that are going in for some type of surgery, in particular cataract surgery, because it can help reduce the risk of complications and reduce the amount of dry eye symptoms you're going to get. And if you want to learn a little bit more about some of the things you can do to prepare for eye surgeries, then you should watch this video right here. And with that, have a great optometry day.